So for our class, we were doing filling out the objectives for differential diagnosis for ischemic heart disease. And I've already listed angina, I've listed myocardial infarction, I've talked about pericarditis. On the list was aortic stenosis as part of your differential diagnosis for a person who has, basically comes in with chest pain. Okay, so I'm going to explain really quickly. Aortic stenosis is going to be a shorter video, and then I'm going to move on and talk about another one of the differential diagnosis. First of all, explaining aortic stenosis. What's the idea here? Okay, you have the aorta, comes off the top of the heart like this, comes around, right? Little valve from the aorta. It's called the aortic valve. Very nice, okay? So the left ventricle is the chamber of the heart that pushes blood through the aorta, through the aortic valve, into the aorta. And sometimes this valve can become stenosed. When it's stenosed, it means that it doesn't open properly. Okay, it doesn't open all the way. So normally you want a valve to open up all the way, and when it closes, you want it to close all the way. If it doesn't open up all the way, they call this stenosis. And if it doesn't close all the way, like stays open and blood can regurgitate back through again, they call this regurgitation. The part of the differential diagnosis I'm talking about now is going to be aortic stenosis, meaning that this valve is not open all the way, so it only opens part of the way. So if it only opens part of the way, that means that not all the blood can get out as easily, which means that blood's going to have to kind of, it's going to be like putting your finger on the end of a hose. It gets kind of turbulent as it comes out. Sometimes that can even destroy red blood cells, and a side effect can be anemia, hemolytic anemia, because your red blood cells are turning into schistocytes or helmet cells. They're kind of getting ruptured, so they're going through there. So what can cause this? There can be a number of causes. Sometimes there's a congenital abnormality where normally this is supposed to, the aortic valve is supposed to have three little leaflets on it. Kind of looks like this. It's got this little three leaflets, and they open up and it closes and looks like that. But sometimes a person has a congenital abnormality where instead of having three leaflets, they have two leaflets. And if they have two leaflets, then this valve can't open enough anyways. And as they get older, this valve becomes calcified. And by the time they're about 40, this valve will actually start to not open so much that it causes the aortic stenosis. So that's one of the causes. This could be a combination of the fact that they have a congenital abnormality called bicuspid aortic valve, combined with the fact that this valve has now become calcified, and it results in aortic stenosis. But even a person who has a normal tricuspid aortic valve, if this thing becomes calcified enough, which is usually after the age of 60, same thing. If it gets all calcified, it's not going to open properly. When you listen to the heart, you're going to hear that little click. They call it I believe it's the ejection click, and it's not going to open up all the way, and so they're going to have aortic stenosis. Another one that's mentioned is rheumatic heart disease. But a note here: mitral valve is affected first, then maybe the aortic valve in rheumatic heart disease. We talked about rheumatic heart disease earlier on when we were talking about different causes of pericarditis in part 2. So possibly after the mitral valve is affected in rheumatic heart disease, the aortic valve may be affected as well. But if it's not just going to be the aortic valve. In fact, that could even be a way of discerning whether or not their aortic stenosis is caused by rheumatic heart disease as opposed to calcification or some other cause, because calcification can happen just in the aortic valve, but rheumatic heart disease, it's going to be the mitral valve first, and then maybe also the aortic valve. But it's not going to be the aortic valve without the presence of the mitral valve. Sometimes a person can even have a unicuspid valve, and I don't even know how to draw that. But sometimes that is extremely rare. And lastly, this can be caused from syphilis, where essentially the aortic root gets messed up and that messes up the valve and the person gets it. Okay, so those are the different causes. What's it going to look like? Well, you're going to take your stethoscope and you're going to put it in the second right intercostal space. Okay, so remember you've got your ribs here. They call them the costal is the term they use for it all the time. So you go over to the right side and you go down here to the second inner space on the right side, and there you're going to see they have this little acronym where they say, this is silly, but all physicians take money. Okay, so this is where you listen for the aortic. Okay, because remember the aortic starts over here and branches over this way. This is where you listen for the aortic valve. Over here is where you listen for the pulmonic valve, because it's kind of back behind that. And then down here is where you listen for the tricuspid valve, which is the TIG, and the M is the mitral. So this is the different places you listen, okay? Whatever. Anyway, so you put your little stethoscope in this spot right here and you're listening, and what do you hear? You hear this. Okay, first of all, you've got S1. Okay, S1 is going to be, you know, the mitral and tricuspid valves closing. Okay, so mitral and tricuspid are now snipping closed. They've been filling up with blood, and the blood's gone down into the ventricles, and the ventricles just start to contract. And as they just start to contract, you know, the mitral and tricuspid valves snap closed so that the pressure can build up inside the ventricles adequately to push blood through the aorta or into the lungs, you know, on the other side. Aorta goes to the body. The right ventricle, however, goes to the lungs, so it'd be pulmonary. So anyway, that happens. Pressure building up as the ventricles are contracting, and then you hear this little. Usually, it's going to be this little. They call it the ejection click, a little click, and that click is like usually because the valve is calcified and everything and messed up. You hear a little click, and then this is happening just as it's opening because the pressure in the ventricles that's squeezing down has become so much that it's overpowered the pressure in the aorta. So it's gonna push through. That valve's gonna click open, and it's gonna push blood now through the aorta. And the blood, and as it goes through, you got to remember it's making this kind of noise, and they call it a crescendo decrescendo. So as it starts a small sound, and then as it's really clamping down, it increases, and then it goes away. So that it crescendo decrescendo. Okay, so starts out like it's this loud noise. It's a systolic. It's during systole because the heart's clamping down. That systole, diastole when it's relaxed. So it clamps down, pushes the blood through, and pushes it out. And so when you're listening here too, that actually this kind of the kind of spraying of blood through the aortic valve is going to be so intense that it'll actually radiate all the way up into the carotid sometime. And you can hear something called the carotid bruit. Type that up, if it's spelled weird, B-R-U-I-T or something like that. I don't know who comes up with our language. But anyways, radiates the carotids, and you put it over the carotids, and you hear this carotid bruit. YouTube, you hear the sound. And you go to their peripheral pulses, and sometimes you'll find the peripheral pulses are weakened or delayed. Why are they weakened or delayed? Well, because the blood normally, the whole thing would just open up and there'd be lots of blood pushing through there, and you get this nice strong pulse. But in this case, it's like that, and because it's just not very much going through, or it's slowly going through, the pulse is going to be a little bit delayed and kind of weak. Because remember, it comes off of the aorta, there's got those three branches on the arch of the aorta, and those three branches supply the heart, and they also supply the arms as well. Okay. So last thing is that may happen is sometimes you'll get a syncope. Syncope is where the person gets kind of like, they're kind of dizzy or whatever, and feel like they're going to pass out. And that's because the blood remember, it goes through the carotids, and it branches off in an internal and external carotid, and the internal carotid goes up and supplies the brain. And so in the instance of a person who might have aortic stenosis, it's possible that there's not enough blood getting to their brain, and so they feel kind of dizzy, like they're going to pass out. And lastly, they might also get some chest pain, some angina, which is probably why this is on our differential diagnosis for ischemic heart disease, because there is sometimes some angina or some chest pain associated with aortic stenosis, just as there is with ischemic heart disease, whether it be an actual, myocardial infarction, whatever. And then lastly, they might have some dyspnea. Dyspnea, D-Y-S-P-N-E-A, is a way of saying shortness of breath. Dyspnea is shorter than saying shortness of breath. And there it is. And then the sound closes off at S2 as the aortic valve closes. And that's the end of this video.